Hi, welcome back. Today I'm going to talk about those sneaky and often baffling trauma triggers. And I'm going to show you a couple of ways to tone the vagus nerve to self-soothe whenever you are triggered. One way I explain triggers to clients that seems to resonate with them is if it's hysterical, it's historical. So this happens. Say, for instance, your partner is looking for a bar of soap. And they're kind of annoying. They're making a big racket, and it's kind of annoying. But this is your response. You scream profanities at them whenever they ask you where the soap is. It's not about your partner making a racket or looking for soap. It's about some original trauma that is stored unconsciously in the nervous system that got triggered by a sight, a smell, a sound, a facial expression, a tone of voice, a physical sensation, something that can seem so minuscule. But the nervous system reacts as if it is back in the original trauma. In this scenario with the bar of soap, the fight response is triggered by the sound of drawers opening and closing, cabinets opening and being slammed shut in a way that the triggered individual perceives as frenetic and threatening. And that's due to a childhood trauma that's associated with a particular sound. Now, understandably, that big response makes no sense to the other person. It can wreak havoc on relationships. And the person who's triggered doesn't even know why they're doing it, especially if they're new to trauma therapy. So if you're often told that you overreact, you are likely having a trauma response to something that you have sensed in your current environment that hooks into a trauma from the past. So remember, if it's hysterical, it's historical. Now, since the vagus nerve modulates our fight, flight, freeze, and fawn response, it's critical that we tone the vagus nerve so that we're better able to accurately assess threat or safety in our current environment so that we can respond appropriately. I have a couple of vagus nerve toning exercises for you today. I'm excited to show you. Both of them access and tone the vagus nerve through the ears. So you may remember from my first video, the ears are heavily innervated by the vagus nerve. The ears and down the sides of the throat are the areas where the vagus nerve is closest to the skin. So those are the best places for accessing the vagus nerve externally. So the first one I'll show you is a simple ear massage. So I have my own line of plant-based organic therapeutic balms, and this one is my vagus nerve balance balm. So what I'm going to do first is just take a deep inhale straight from the tin so that I can get the aromatherapeutic benefits. Then I'm going to rub the tips of my index fingers across the top of the balm. And I'm going to massage the balm in and around both ears. Now, the ear canal is off limits, but all other areas of the ear are fair game. And then down the sides of the throat. I strongly suggest making this a part of your daily self-care routine and do it for about 3 or 4 minutes. We use the skills we have when we don't need them so that we can access them when we do. When we are in a trauma response, our frontal lobe goes offline, shuts off, completely goes dark. So it's very difficult to access the tools that we know. But once it becomes a daily habit, we're much more likely to be able to access them as a rescue technique whenever we are actually triggered. Another technique requires a device. It can be found in our Somatic Wellness Center, or you can order one for $300 or $400. It's called transcutaneous cranial electrotherapy stimulation. So I'm just going to call it CES. You may have heard it called an alpha stem, which is a brand of CES. But to use this to tone the vagus nerve, you have 2 electrodes or 2 ear clips. And and they have these little pads on them, so your ear is not exposed to the metal. So you take one and you place it pretty high up on the earlobe, the left earlobe. And then you place the other clip onto the tragus of the left ear, which is this one. So you clip that on. And then all you do is you turn it on, you set the timer, you set the intensity of the current, and you sit back and relax. So these are 2 methods of toning the vagus nerve that are extremely effective and pretty easy. I hope this was helpful for you. Please leave any questions in the comment section and I'll get back to you. And I will see you next week. Thanks so much.